Hello guys, so today we are going to make video on modular OT. So what is the basic requirement for the modular OT? What are the different equipments? What is the basic things are needed for the modular OT? See, now we are present in a modular OT. Construction is undergoing on. This OT is under handover process. So in the modular OT or in any OT, basic things are there. There is the first OT light. See, you can also this is nothing but an OT light, right? For the performing the what we can say that operations, there should be a OT table, right? Below the OT light should be a 2 down. Depend upon the surgeries, there are different type of OT lights like the food light, warm light, etc. See, basically, second most important requirement in OT is different type of gases. Like so, this is nothing but anesthesia patent we have installed here. It consists of 2 oxygen, 1 nitrous, 2 air, 2 vacuum, and 1 carbon dioxide. If laparoscopy surgeries are there, for that carbon dioxide is also required. See, whenever there will be a modular OT, always one outlet should be extra. If there will be a sometime there will be any what we can say that breakdown happens with any one outlet, so standby should be there, right? So each and every this oxygen gives you 4 bar pressure, air will give you 4 bar pressure, this vacuum will give you 350 to 400 mm of Hg. Carbon dioxide it is around 7 bar, 6 bar pressure. Nitrous oxide it will give you 4 bar pressure. Right? So this is nothing but your anesthesia pendant. Next thing, this is nothing but called surgical pendant. See, it is 900 mm by 700 mm surgical pendant. What are the equipments are required? We can place on the surgical pendants like the pottery machines, laparoscopy system, or anything else, right? So you have a monitor arm is also connected to the surgical pendant that has to be pending. That has to be pending for the installation. Once it gets connected, we will attach to the surgical pendant. Conclude, for the standby purpose, we have given gas outlet to the surgical pendant also. These are the 2 oxygens, 2 vacuums, and CO2. So, if CO2 is separately you are going to put on the surgical pendant, you can give CO2 input to the what we can say that CO2 in separator. And this is the movable. See, according to your requirement, you can move. Right? You can move towards the patient, away from the patient. Right? In bidirectional, it can move. Right? So, this is called the surgical pendant. Conclude. So this is nothing but X-ray box which we have to attach. This is nothing but on-off switch for the X-ray box, right? Suppose with help of these 2 switches, we can increase its intensity or we can decrease its intensity as per our requirement, right? So this is nothing but main control panel of OT on which we can observe different parameters. So these are nothing but medical gas alarm. It will show you pressure is normal in medical gas pipeline. See, oxygen, nitrous, air 4 bar, air 7 bar, vacuum, and HEPA status. Now we have disconnected nitrous, that's why it will use you low alarm, and all other pressures are normal. If it is green, that means it is okay working. If it is red, that means there is an issue related to the pressure. So they have given telephone answer. With help of this, you can call anywhere, right? It will use your room humidity, it will use your temperature, right? These switches they have provided for the control of OT light. See. With help of this, I can switch on, switch off this section of OT light. Okay. With help of this, I can control another section of OT light. And they have given these 2 arrows. With help of this, we can increase the intensity or decrease the intensity of the OT light. And third one is for the OT light, right? That is a which is in front of what we can say that operation table. So that OT light you can on off from here. So it will use your time delay clock and it will be a elapsed time clock or we can say that timer, right? So this is nothing but basic control panel. With help of these switches, you can on off HVAC, right? So for that they have provided these 2 switches. So this is nothing but your control panel. So and these are nothing but HVAC inlet and outlets. Through this, what we can say that with help of this, it will suck the air, right, from the OT. And it will be released from the HEPA. See, this is nothing but your laminar airflow or we can say that HEPA, right? For the modular OT, HEPA is very important. Such type of suppose there are some complicated cases like knee replacement, liver transplant, etc. For that, HEPA should be required to avoid the infection for the patients. In OT, basically they have provided such type of dampers. You can observe these are the dampers. When all doors get closed, it should be increase the pressure inside the OT. And for the closing or opening of doors, such type of dampers will help to reduce the pressure which is built up inside the OT, right? So, and second thing, this is nothing but door of the OT, right? Now it is under construction, come close. See, in OT, what they have given, these are nothing but lights they have provided. One is green, one is red, right? If that red light glows, that means procedure is under process, and if green light is there, that means it has to be finished, right? So one more thing, they have given writing pad also on this. What is the surgery going on? What is the name of patient? What is the procedure name? All the things you can write here. For what is the use items? Suppose you want to remove outside of OT controls. This is nothing but they have given a pass box. What is use of pass box? What is the linen or unused or used equipment and all the things we can transfer through this. So what is the use of this pass box? At a time you can open only one door, right? So I have to put the equipment or linen here. I have to close, right? And from the outside you have to place that open, and then only you can open the door. That means outside of area get isolated from the OT. That's why such type of pass box is available inside the modular OT. Right. So this is nothing but basic things related to the modular OT. One more thing. Come here. So this is nothing but scrubbing area. When doctors are going inside the OT, they should be a scrub. They should be clean their hands properly. So these are nothing but automatic system. With help of sensor, water will come out. Right? There will be a automatic soap dispenser, and sometimes suppose it is electrical part, electronic part, suppose it get damaged, so manually also you can take the water, right? And one more thing I would like to tell you. So they have given one what we can say that one meter here, right? So what is the use of this? What is the pressure exists inside the OT? It can be displayed here. Okay. So come inside the OT. So and what is the chlorine has to be installed in the OT. It is an anti-static chlorine. It will not create an electric charge. That's what it's called. Anti-static chlorine is to be required. According to requirement, they have provided different electrical switches for the connection of OT table, connection of what we consider microscope, connection of different type of accessories in the OT. So this is nothing but your basic things related to the what you can say that modular OT. Thank you very much.